years ago, the news of the death of a 31-year-old woman due to rabies shocked central Bangalore. She presented to the hospital with symptoms of rabies about 4 months after a dog bite. A simple Google search will show you that in Bangalore city alone there were 5 deaths due to rabies in 2020. So what is rabies? Am I at risk from contracting the disease if I adopt a pet or if I go on a wildlife safari? Rabies is a viral illness that is lethal but 100% preventable. India accounts for 36% of the global human rabies deaths. If a rabid animal bites or scratches someone or their pet, it can transfer it to them. Rabid animals such as wild animals, bats, dogs, and cats are the primary cause of rabies-related deaths in humans worldwide. The central nervous system is affected by the rabies virus. The virus can create a disorder in the brain that will ultimately lead to death if the right medical care is not given to a person following a possible exposure. So what can prevent rabies? Pet vaccinations, avoiding contact with wildlife, and seeking medical attention immediately after probable exposure before the symptoms can appear can all help prevent rabies. When to seek care? A healthcare or a public health specialist should be consulted if you have had contact with any wildlife or strange creatures. Even your pets, especially if you have been bitten, if you have had licks on damaged skin or scratched, to ascertain your risk for contracting rabies or other diseases. Plan to see a doctor immediately after you clean your wound with soap and water. Though it is not an emergency, rabies is a medical crisis, so make decisions right away. Pre-exposure prophylaxis. If you are in regular exposure with wild animals or unvaccinated pets, then a 2-dose vaccination with a follow-up booster is recommended. Post-exposure prophylaxis. There are 3 categories of bite which require post-exposure prophylaxis. Number 1, touching or feeding of animals or licks on intact skin. These do not require any vaccination. Number 2, minor scratches or abrasions. These need anti-rabies vaccination. Number 3, transdermal bites. These are bites that penetrate the skin or draw blood. Or licks or broken skin. These require anti-rabies vaccine as well as the anti-rabies immunoglobulin injections. There are some special conditions for us to take note of. There are some patients with very low immunity levels, those on chemotherapy, steroid therapy, those suffering from certain chronic diseases. These people mount a significantly lower immune response, and they will require vaccination irrespective of the category of bite, as well as blood tests to assess need for additional vaccines, as well as a requirement for immunoglobulin. Always remember, prevention is always better than no cure. Get your pet vaccinated, and if you are exposed to the rabies virus, take the appropriate treatment immediately.